certainly age and exercise both have an effect on our bone mass. And so the more we exercise, the more our muscles contract, the more they pull on their attachments. So what we're really saying there is the more that muscle pulls in the periosteum. And the periosteum, when it gets stimulated, it will increase our osteoblast activity, which, as you know, is a bone building mechanism for us. When people hit puberty, there are some hormones that are become active there, and they increase the opportunity for osteoblasts to do their job as well. This is very important to the closure of the epiphyseal disc, or in other words, how long the bones will grow. So, which is important because we don't want them to be longer than they need to be. And as we age, then our bones start to decline in their structure. And unfortunately, this begins as early as age 30. Osteoblast activities decline, but osteoclast works at the same rate. So every 10 years, women lose about 8% of their skeletal mass, where males only lose 3%. And that's because as we get older, women, there's the hormone estrogen, the loss of that contributes highly to that. What we'll see eventually with everyone as they age is that the epiphysis of the bone in the vertebrae and the jaw suffer the most bone loss, and we end up with fragile limbs. We end up people with fracturing their hips and they haven't even hurt themselves. They get shorter in body height, and of course their teeth fall out, which is just a horrible thing to think about. The more active we are, the better we can reduce the risk of this. We can't maybe prevent it depending on how old the person goes, but the less active we are, definitely we will be in more trouble with that, which is why we see more injuries as people age. So just a picture here of someone in terms of their the look of their posture. So age 40, you can see they're fairly good alignment here, okay? Age 60, they're starting to tip forward just a little bit, okay? And by age 70, they've got more of a kyphosis than before, so the curvature of the spine. So it's important to understand this because imagine if you were feeding this person, you know, their head is looking downward and they're not getting the full benefit of being able to see what you're doing. So very important to have a good knowledge base of that. Now, our bones, as we said in our earlier when we talked about the function of bones, they work as levers. So let's go to the picture here. So there's 4 components to this: a rigid bar or rod, okay, a fulcrum or pivot point, and resistance or force. So bones are the rigid structure that move the fulcrum. The fulcrum is the joint, okay, the joint. And force from a group of muscles. So we're looking here at the anterior muscle, which is the biceps muscle, helping us lift this, versus the tricep is working on this one. And throughout that process, then with that structure, being able to do that, our bones help us move things in a certain way, okay?